Okay, so this is one day after a bilateral breast reduction, breast lift, removal of the subpectoral or under the muscle saline implants, left capsulectomy and capsulotomy to release a capsular contracture on this left-sided breast, and the removal of the existing saline implants and replacement with a little bit larger silicone implants under the muscle. So yesterday she is here sitting with, she left here yesterday with zero pain. I don't see any bruising or bleeding. The stair strips are completely white and clean. She is very happy with the progress. The reason why we had to do capsulectomy and capsulotomies on this very breast is because this breast had a capsular contracture. Not a very bad one. Her breast was not deformed, but it was just a little firmer than the other side, and the capsule was a little thicker. But she's one day out. She's very shy. She doesn't want to talk, but she looks absolutely beautiful. And this was the breast that had deflated because the capsular contracture is like an internal keloid. It's like a scar that's very thick and starts compressing on the breast, eventually breaks the implant, which is what happened in her case. But there is 4 degrees. So there are 4 degrees of capsular contracture. One is normal, which is what she had on the right breast, which is normal. It's a little thin capsule. In her case, it was translucent, very, very thin. You can even see the implant. If you see the surgery, it's beautiful on the right breast. On the left breast was more opaque. You could not really see through the implant, and it was a little thicker, but it had not deformed the breast, although she did have a rupture, so it could have been a higher grade maybe, but I classified it as a 2. This is according to the Baker's classification. And number 3, capsular contracture, is when the actual breast is deformed, which I did not feel that I didn't see a deformed breast, although the implant was already deflated. But with a capsular contracture grade 2, which is what she has, it's just, it feels a little firmer, it's a little thicker. And a capsular contracture 4 is when there is actual calcium. It's like a wall. It's extremely hard, almost like a concrete. So you can have that, and is rare, but it can happen. And so anyway, her breasts are now soft and beautiful with excellent aesthetics. And we only did a lollipop incision, meaning an incision around the nipple, which is now covered for social media, and another vertical incision coming down from that areola. We made her areola smaller, lifted, and look at the projection and how beautiful she looks without a single bruise, no bleeding, no drains whatsoever. This is just incredible. And she probably bled just a half a teaspoon throughout the entire